As many of us know, eating uncooked meat, poultry, or eggs can leave you with an unpleasant salmonella infection. Salmonella are a group of rod-shaped bacteria that cause a bacterial infection affecting the intestinal tract of many animals and humans. However, some of the more unconventional ways salmonella can spread is through dry dog food, dog treats, raw diets, livestock, and pet reptiles such as turtles. Because of the increased domestication of animals in the U.S., opportunities for zoonotic diseases like salmonella are only increasing, and when we don't take precautions to protect ourselves, humans, animals, and the ecosystem's health are threatened. Most outbreaks in the U.S. are caused by fecal-oral transmission where an infected animal's feces contaminate crops, water, or other foods consumed by humans. Some of the other common ways transmission can occur is by not washing our hands and cross-contamination of foods. For example, when we feed our pets, forget to wash our hands, and then continue cooking, we're inadvertently increasing our chances of salmonella infection.
Salmonella is a multidisciplinary approach to One Health because it can have an effect on humans, animals, and plants.
Many individuals with a salmonella infection will experience short-term symptoms such as diarrhea, fever, and abdominal cramps. However, some long-term complications that are concerning to public health officials are dehydration, bacteremia, which is the presence of bacteria in the bloodstream, and reactive arthritis, which leads to eye irritation and painful joints.
For the top-down approach, we start with the policymakers. Pet food is highly regulated by the FDA. However, each year there's seen numerous recalls involving salmonella-contaminated pet food. Therefore, lots of stricter regulations should be made to ensure the quality of the pet food and the industries are meeting this standard. These standards are that food are safe consumption, produced under sanitary conditions, contains no harmful substances, and a truthful label. Second step would be to address pet food industries and to ensure that they maintain the standards set by FDA, and that the products are properly handled during the production process. Retail stores and sales displays should display signs regarding proper hand washing techniques to educate the customers about the danger of salmonella transmission. On a third tier, community level, we focus on educating and spreading awareness among pet owners and their family about the potential dangers of salmonella contamination in pet food and the treats.
Communication would begin with lobbying with the FDA regarding label guidelines, strengthening them to include warning labels on unconventional contaminants such as dog food, pig ears, and raw meat labels. Flowing down the One Health top-down triad, communication and advocating with veterinarians and local public officials to increase awareness of salmonella contamination. This can be done by implementing pamphlets into veterinary practices for pet owners to look at and take home to keep on hand.
Roadblock. Managing how FDA is doing their job at that microscopic level is impossible because we can't guarantee how each FDA inspector does their job. However, we can see that in the previous years, the FDA has done a great job in catching outbreaks, especially salmonella. Within the past year, salmonella has been identified and caught by the FDA 6 times. With this much awareness and essentially practice, we can see that although we can't control the FDA on the microscopic level, different levels within the FDA will be keeping each other in check with the quality of their work.
The bottom-up approach to the salmonella infection starts with educating the community by informing them how salmonella is transmitted and the prevention steps needed to avoid contracting it. Our aim of focus is directed at farmers and pet owners. Salmonella is known to damage plants by infecting the interior. Therefore, it is really important to educate farmers on how they are able to ensure the safety of their crops. With pet owners raising awareness about how some pet food options have been tested positive for salmonella, educating them about which types of food to stay away from is a great initiative for pet owners. Moving up, it is significant to establish communication with manufacturers who are in charge of producing and packaging the pet food. Establishing protocol and testing for whether or not salmonella is positive or negative is a great preventive step at this pre-distribution level. Further up, working with veterinarians and doctors to make sure pet owners and patients are well aware of the salmonella infection. In the One Health toolbox, professionals included would be doctors, veterinarians, water treatment specialists, engineers, epidemiologists, laboratorians, hydrologists, local stakeholders, and policymakers.
When dealing with an easily preventable outbreak such as salmonella, it's important to consider that communities and individuals are ultimately the ones who will have to change their actions and prevent further infection. This is why a bottom-up approach must be considered. The goal here is that the communities of pet and animal owners become aware of the issue, and through their changed actions, such as buying better quality feed or communicating with suppliers or veterinarians, it goes higher up. Eventually, those manufacturing animal feed or regulating it make changes based on the supply demand of those types of food, or because they don't want to be linked to an outbreak. One of the first ways individuals and community members initiate a bottom-up approach is to change their actions themselves. Start going to the store and purchasing equipment that will allow you to clean animals' cage or pick up after them without having to worry about an infection. This is likely the quickest, cheapest, and most effective way to prevent contamination in individuals. However, for preventing community infections, a wider approach still should be considered.
Roadblock. Some pet owners do not want to believe or accept that salmonella is a possibility, so they choose to be ignorant. However, what we can do most is provide these individuals with resources. When resources are made and verified, people will soon begin to take the proper steps to believing that there is problem and danger. Therefore, by continually providing verified resources and facts to educate the public about this matter, we will steadily be able to change their mind about the possibility of salmonella when handling their pets.